Good afternoon. Hey, thank you for joining today's session on value-based care and healthcare finance in countries and global NGOs. We will not be focusing on the US, we'll be focusing on different countries and then global NGOs, non-governmental organizations. I appreciate the time. I'm James Mansfield with Analytics for Living, where we apply machine learning and artificial intelligence to improve health, innovation, technology. Great. So let's jump in. So the objective today is to review and discuss how machine learning and AI and reporting and analytics can enable value-based contracting for life science manufacturers, healthcare providers with analytics for living services, right? So first thing of disclosure is that the views are here are mine, not from any company or other prior client or current client. Our agenda is we're going to have a brief introduction, talk about the problem statement around the value demonstration, why it's needed, discuss value-based contracting, the modeling, the development, the execution, and then discuss the collaboration, right? The analytics delivery, the platform, the cloud environment, and so forth. So we'll jump right in, and feel free to ping any chats or questions throughout, and we'll have a few minutes at the end as well. Perfect. Okay. So executive summary here, just a kind of the high level here. So applying artificial intelligence machine learning to improve health, innovation, financial support, right? That's our kind of our theme here with this. And as I'll start on the left, that analytics clearly with the data and everything that's available, or data that's out there and the technology that's out there, really needed to sustain health, innovation, and financial stability, right? The first bullet there is that the health of populations and helping patients is dependent on and can be improved through advanced analytics, right? There are increasing rates of chronic disease, mental health, preventable diseases, pandemics, right? And the innovations to treat and supply all require analytics and investments, right? And what's great now is that there's data, technology, and analytical tools such as machine learning and AI that are at the inflection point, right? The inflection point to make great impact to help patients, right? So applying this technology, the ML and AI technology to the tools, enabling that intersection of health and life science problems, right? Enables data investments that need to improve to sustain innovation. That's kind of our, our vision there of this kind of, set the stage for this global, value-based care. So how do we apply it, right? The application of machine learning AI can be applied through to challenging life and health science problems, right? So and why we call it challenging is, well, there's significantly large data sets, right? And then there's significant new innovations that require big investments, right? So with all of that, how can we use the data to try to drive and show the value? And there's certainly health challenges, right, that accompany the data, and also, this life science innovation. So our machine learning AI solutions really enable, value-based care, right? From a product standpoint, if you're a pharma, biotech, med device, if it's a service, you're a service company that it has therapy or treatments or care programs or formula, or want to change the formulary or change a product from one product A to product B, or even health value, right? If you wanted to understand the value of the savings and the research piece, and then even if there's an investment that's needed, right? All these pieces can really utilize machine learning and AI to kind of drive and provide the value. So that's the executive summary. So why do I have this vision and so forth? So my responsibility is at Analytics for Living I do lead Analytics for Living, so where we apply artificial intelligence and machine learning to improve health and innovation. And then at Data Prime, I am a consultant and help them help lead the life science practice as well. And prior to these two initiatives for me, I had 25 years in life science and also have spent time in the consumer packaged goods, financial services, and most recently I come out of Merck and GSK, where I work closely on these topics as well with a lot of experience. Great. And then Tyler Roth is not able to join us today. She comes from Data Prime. She leads talent acquisition at Data Prime, and we've set up and structured this arrangements because, certainly if you have analytics and you have these needs, right, then you're going to need staff to fulfill that, and that's where Data Prime can come in to support teams, to individuals that come into your organization that could help. It's great to have Tyler. She has U.S. government experience, Amazon, Comcast, or also really great experience, long-term longevity experience as well. Perfect. So let's jump into the topic here, or the problem statement here. So problem statement I'm going to say is around, why value-based care is needed, is that healthcare costs are rising, right? System prioritization is happening, meaning the system's prioritizing different products, right? And life science innovations, right, are continuing to evolve and come out, right? So the situation is they're all interdependent, right? Let's break down healthcare cost, right? Why do we say it's increasing? Well, we know that it's growing faster than the GDP, right? We see that the system resources and the costs, right, and out of pocket are being shared from the government, the patients they aid, right? And here's the pictorial, right? Here's a woman that's coming in to buy some product, right? The pharmacist is trying to kind of adjudicate the claim, and she's saying, "Oh, well, how much money am I going to have, right, on her first site? How much is it going to cost me, right?" So that's going to continue to happen, right? As the system kind of says, let's prioritize more, right? Those costs go out and increase those patients' costs, right? Which is a challenge for patients, right? So what can be done in this case, right? So we'll get to the next slide on that, but let's talk about the life science side. So life science, right, to bring a new innovation to market, which definitely help and save and improve lives, right? Costs from anywhere from 0.3 billion to 2.8 billion, right? Almost $3 billion, right? On one of the really technical, products as well. So this is significantly, a large investment, right? So what does that require? Well, it requires, the health system to pay for these things. But if it doesn't show value, if the project doesn't show value, how's the system going to pay, right? Because it has to show some cost savings, right, and so forth. So I think that's kind of the interdependence. So I'm saying, there's this opportunity. So to frame it out in terms of like a process or kind of where they're interdependent, there is this opportunity to change, right? If we have the patient in the middle, right, and then number two is the health system, providers are providing to the patient, right? The government or public system or private system, if we're talking about X, in many other ex-US kind of globally, whether it be an NGO or the countries, right? But primarily the public government's going to pay. There are some private, right? But primarily it's the public government's going to pay, right? And if the public government can't afford, right, the product, then it's not going to get out there, right? So what we're proposing here, that there's this new opportunity for financial services that, let's say a government can't pay, costs are still going through the roof. There's a new product that could decrease those costs, but they don't have the money to invest for it. Well, why not offer them a loan, right? Offer them a loan where they could save and improve lives. They can make an impact. They could save costs. And essentially the financial services provider would front the loan, but then the savings would pay back the loan, right? Pretty straightforward. I mean, they do that today just for life science innovations, right? But why not do it to when we're, after the innovation is out in the market to kind of save and improve lives too as well. Of course, machine learning and AI needs to fit in all these instances, particularly in that loan repayment, because it's not going to be as easy as, okay, you have diabetes, you took this product, you saved this cost. No, we're going to have to use machine learning AI and say, okay, this patient touches all these services, right? And here's how much they cost. So, hey, this is the savings, right? To quantify it, because we're going to have to differentiate, the cost versus other things when it's already increasing, double-digit growth, right? And then lastly, and here, the life science innovation, if they had the investment, they can innovate to provide, right? If they don't have that financial investment, if they don't have that savings, if the system doesn't go around, there's not going to be innovation. We're not going to be able to save more lives. You're going to look like this pharmacy, right? Which is terrible. Broken down, not a lot of products, trying to get something, no computer adjudication. I don't even know. It looks, they got one electrical cord there. It looks like all the other lights are out. I think, oh no, there's some lights at the top. But we don't want that to happen, and that's why it's important to be, kind of have that interdependency, right? So where does Analytics for Living come in, right? So we feel that we could be the agency of record for this. The reason why is that, or there may be other partners too as well, but we really feel we can because, from that perspective, right? There needs to be a capability around machine learning and AI to quantify the cost, the savings, the innovation, the loan amount, and track savings, and that's kind of that central black circle there, right? If you think about that, how can we, track those costs and be that agency of record for these partners? So if they do get a loan and they drive that, how does it, provide back to those patients and save some costs, right? So here's an illustrative example of how, right? I'm going to say how you do that. So in this case, right, we're trying to show, and this is an illustrative example, but a real life example, right? We're trying to show where an innovation was introduced and it saved and improved lives, right? And a loan was offered and help patients, right? So essentially, you're seeing here is, and I'll walk it left to right. I'm going to have you focus on the graph, right? Step one, and the steps, and as I talk through the graph is kind of how we approach this. So if you're a healthcare system, in this case, healthcare system, you're looking and you're seeing a disease state, right, increasing 5% per year, right? And each patient the cost of each patient getting a service is $6,000 a year. So you have $6,000 a year, $6,000 per patient, growing 5% per year, right? And in this point, right, or year 2, year 1, right, they want to say, okay, well, what should we do with this instance? And they're at, they have 1,200 patients, 1,200 patients, but 1,200 patients, right, is like close to almost, $7 million, right? It's a significantly amount of investment, right? So they said, well, hey, there's this new innovation out there, right? This would be ex-US in another country, right? That could be introduced into this country. The government would have to pay for it. It's a public system, right? Uh, Patients are going to have it. The 1,200 patients. Maybe not all of them can have it or are eligible for it because of whatever, but for the most part, we'll see most of those people, right? And the theory is, can it decrease these costs, right? And the modeling that we did in machine learning AI, right, clearly does show that we could do that to demonstrate it. So a loan was written, so you see the cost increase, right? But then over time, um, the cost savings were there. Those patients that were spending 6,000 were not, right, because they weren't going to use those services, right? So then those patients that were helped by the therapy or the medication, right, decreased. So they had a number that kept on decreasing, and because of the savings, right, it paid back the loan, right? So it paid back the loan over time, and essentially at the end of 5 years, right, the healthcare cost, right, went or the number of patients, as say, went from 1,200 to about 350 patients. And I think I have some clicks here, right? So 5% per year, we talked about that. 350 to 1,200 patients, right? 1.5 million from 7 million. But then here's the other interesting point, right? If you look at the cumulative savings over time in this case, if nothing was done, the difference is $23 million. Right? So you're at 7, but if nothing was done, you'd be up to 23 million on the cumulative piece, right? And it wouldn't just be 1,200 patients, it'd be 3,800 patients, right? So significant impact just from that. And it's about thinking out of the box, right? It's the healthcare system in that country in particular may not be able to afford it, or the NGO maybe that has stepped in this case, wasn't going to, needed to come up with the money, right? But they needed to justify kind of that investment, show value. It's not just a give, right? On the terms of this case, that's to demonstrate value. So that's kind of the steps, right? As I walk through, I said step 1, patient's cost. Step 2, let's estimate the value. Step 3, let's use the machine learning AI to kind of track those costs over time and estimate that savings. I try to keep it simple here as a straightforward approach, but it's definitely, a good approach that can be applied to many other, issues from the NGO as well as a country too as well. So where else can we apply, this approach? Well, innovation's clearly one, right? If we're looking about new products, farm biochem and device, services like care programs, education outreach, benefits. And say the benefit plan of the public system or the private system changes, right? So want to improve outcomes, right? Want to run a health wellness program, right? Or want to get more compliance or adherence for a product, right? If we look at diabetic patients, and if they don't stay on the medication, they have diabetic coma, and then they're in a hospital trying to the cost rate. How can we keep them on therapy, right? And then from the formulary, maybe there's one product that needs to be moved off to another one, right? And we need to estimate those copay programs. Like all this, these can be used for machine learning and AI to kind of understand what those impacts are, as well. So I know we're almost out of time, so I'm going to jump in just a little bit of background about Analytics for Living and where we could support your needs. But Analytics for Living, right? Our vision is to enable analytics for life. Our mission is to improve access to life-saving innovations, right, for populations and patients. And our approach is we employ machine learning AI to healthcare challenges. Some other related population health type challenges as well, but we're really focused around healthcare challenges, to enable the healthcare ecosystem to gain access to life-saving medications, as we illustrated here. And additionally, Analytics for Living is a foundation. It's a 501c3 charitable organization. And we have some of this work already syndicated for a number of diseases in a number of countries. So on our website, we're asking for a donation, and then you get access to kind of one of the areas that we could look at within the country. So some of the data in many countries is public. So if it's one of the countries you're interested in, we can kind of look and see. If it's not publicly, then let's have a phone call or a conversation, or I don't know if we could do meetings yet, but we could do a WebEx like this to have a discussion or a webinar to kind of discuss this. But the donation enables access. So please go to the website. We have 3 different therapeutic areas on there. And then additionally, we do offer some, customized products. Like typically in this case, right, if we're going to run this engagement, it may need to go over time. So we may start out with the syndicated approach, right? Kind of, get a base case on kind of what we know. and then kind of integrate, the health system data, with another third party to keep it HIPAA compliant and so forth, so that we can, deliver on this on an ongoing basis, right, and de-identify patients and so forth. So that's great. And as I mentioned already about Data Prime, right, they bridge the gap on talent, right, where if you took that solution and you need to staff it, right, that's where Data Prime can come in to help us, find some staff to support on an ongoing basis. So that's great. So, hey, thank you very much for joining today. I appreciate it, and appreciate your interest. And a call to action we say is, subscribe to our Analytics for Living machine learning and AI solutions. Right, go to the website and please subscribe on there. Right, and then we have a lot of other Zooms on other topics related to this, but also specific therapeutic areas. So please join, and schedule a Zoom. If you want to discuss, I'm available, to schedule a meeting. So you can certainly, I'll send you either a link. You can look at my calendar online, or send me a note, and I'll follow up the schedule to schedule a meeting. Thank you very much today, and hope you had a great and enjoyed the session very much.